The next speaker is Professor Dr. Maed-Yeon Sang Lee from the Department of Nuclear Medicine, Seoul National University at College of Medicine. Please.
Okay, thank you. Good afternoon, ladies and gentlemen. I'm Yoon Sang Lee from Korea. So today my talk is about albumin-based disease targeting nanoplatform. As you know that the albumin is an abundant protein in the blood in human, so we can use albumin itself as a nano, just like nanomaterials. So our story just starts from these simple images. If you are a nuclear medicine physician, you can immediately identify what is these images. You can see the high blood pool images. That means that is a blood pool imaging for PET. So we struggle for a nano technology for radiolabeling. So we try to label with the diagnostic or therapeutic radionuclide for a nano platform. So just we try to the albumin-based some molecule. So we just add the click chemistry for albumin moiety. Then we can see the high blood pool uptake in a moment. But especially just after the injection, we can see the high blood pool activity. It is quite sure, but after 4 hours, still we have a blood pool imaging. It is very uncommon for traditional blood pool imaging, such as a technetium HSA we used for several decades for blood pool imaging for patients. So you can see the high liver uptake after the 1 hour, and even in a mouse distribution study, you can see after the 10 minutes, you can see the high liver and spleen uptake. So what is the difference between the earlier one, technetium one, and our one? So also, gamma camera image and SPECT image, you can see the technetium HSA is a high liver uptake. Our new system is high blood pool activity up to 4 hours. So what is the difference? So, I'm sorry. Our system is just to use the copper-free click chemistry for radiolabeling of copper-64. So in case of technetium labeled one, we used several reducing agent or low pH. So this is the difference between the technetium and our new labeling procedure. You can see that new labeling procedure always in a physiological pH, and also that albumin is not met with radionuclide directly. But in case of technetium, you can see the low pH, and then normally we used for higher reactive reducing agent. First of all, we have to know that what is the nature of albumin. So you can see the natural albumin is 20 days half-life in our body. So our system, new system, is somewhat resembles with the nature of albumin. And also, you know that the small modification of albumin surface that can affect the half-life in vivo also. And one more thing, we have to know that our system, we have to know the click chemistry for our system. So click chemistry firstly proposed by Dr. Shapless in 1998, and that old version of click chemistry should use copper as a catalyst, but the copper-free click chemistry is without any kinds of catalyst, just in a DW or PBS, we can clicking of these kinds of molecule. So also one more thing is the advantage for copper-free click chemistry can use the in vivo labeling or in vivo targeting, just used with the bioorthogonal system. And also this copper-free click chemistry can used for nanomaterials, radiolabeling of nanomaterials. So in this information and our data, which problem we can solve? As you know that every old nanomaterials is accumulated in the liver right after the injection, or IV injection. Even though that the targeting ability is high, but still we have a high amount of liver activity or liver quantity you can see. And also in the field of nuclear medicine, we have several tumor targeting agents such as a peptide or a small molecule we used for radiolabeling, and then we can see the imaging. But all the small peptide or small molecule you can see the high kidney uptake. I think a diagnosis is no problem for kidney uptake, but in case of if we use the radionuclide therapy, that kidney toxicity will be the main problem for that radionuclide therapy. So, and also one more thing is high kidney uptake and excretion rate can affect the targeting ability. So we think that we can construct this albumin for a nano platform, and sometimes diagnostic purpose, sometimes we can use the therapeutic purpose as well. And also we have to confirm that the liver and kidney uptake ratio, or we can reduce the kidney or liver uptake with this nano system, and also we can calculate the biological half-life, and we have to confirm that this nano platform concept. So we did several research. Synthesis is very easy and straightforward. So I think you can, if you can see this slide, you can make within a month this nano platform. So just simply purchase from company of albumin and that copper-free moiety, and then mixed with the physiological pH, and then you can get the nano platform. And also that clickable moiety, the number of clickable moiety is very essential for biodistribution. So we can confirm that the MALDI-TOF with that moiety is around 10 to 12 like that. And after the getting the nano platform, we can label with diagnostic or therapeutic radionuclide outside of the that albumin vial. And then after the radiolabeling, we can mix it with the albumin vial, and then clicking is happened, and you can get the radiolabeled albumin. So after the labeling, we have to confirm that radiolabeling efficiency, and almost 100% radiolabeling. We could get 100% radiolabeling yield. And we can compare that our system and earlier radiolabeling system. At earlier one, we have to use that albumin is inside that albumin vial. We have to mix it with the copper 64 like that, and that pH is around 5.5, and then you can see the somewhat slightly different in between these three systems. So our system has a higher biological half-life. And after that, we could get normal mouse images using with gallium-68 and copper-64 and lutetium-177 that is used for radionuclide therapy. And you can see the increase the number of adipo or adipo of the surface on the albumin. You can see the higher liver uptake is happened. And one more, adipo is a alkyne of a ring-strained alkyne, so opposite is possible. Opposite composition is possible, so we can attach N3 on a albumin surface, and you can see that hydrophobicity is reduced, and then you can see the less liver uptake. And also we can quantify with the PET images. The system 1 and 2 is a less amount of moiety on a albumin surface is a higher blood pool activity, and also opposite one is same. And finally, we could get tumor targeting imaging with the N3 folate for clicking first, and then later on that second click is for radiolabeling, and you can see the high tumor uptake up to 48 hours. This one is a folate targeting imaging, and next one is angiogenesis targeting imaging using with the RGD peptide. You can see the somewhat some activities in tumor-bearing mice, and also you can see the still high blood pool activities. So now we just used for two targeting system. We plan to now just the ongoing project is targeting for prostate cancer for PSMA targeting agent, and also albumin itself is target for spark of several types of cancer. And also in vivo labeling capability we have to check, and then after you can see the high blood pool image up to for 10 hours. So you just after the targeting, we can clear out that albumin nanoparticles inside of the body. So we will focus on these topics. So finally, we have a goal. This our nano platform can be used for a diagnostic and therapy and diagnosis purpose also. So we now we can make this kinds of kit formulation and targeting and radiolabeling kit to be prepared, and also I think we can provide for our co-workers. So we can still far away to go to develop our albumin nano platform, but we can confirm that the platform concept, and then to reduce for reduction of liver and kidney uptake can prolong the biological half-life, and then it can be used for diagnostic or therapeutic nano platform. Okay, thank you very much.
Thank you very much. We can take one question. Please.
My interpretation was that you had soluble albumin molecules, it was not nanoparticles. Is that correct?
Soluble nano.
Soluble albumin molecules and not nanoparticles?
Sure, yeah.
And then I wonder if your modification had some effect on the ratio of monomer versus dimer, trimer, tetramer, or aggregates, if you check that, if that could be the reason for the different biodistribution.
Sure. Up to 10 molecules modified our system, then it can affect the liver uptake, somewhat slightly increase the liver uptake, but the blood pool activity is almost comparable.
One last question, Mike, please.
One question I've had and often been raised about this type of approach is whether you're haptenizing the albumin, so raising antibodies. So it will give imaging the first time, but the second time you will have an antibody response to it, or even worse, really, if you enter therapy. So you're raising an antibody to a host protein, a natural protein, if you like.
You mean that that albumin can make an antibody inside our body? Now we just we use a human origin albumin that is very cheap. So later on we can turn into the recombinant albumin. We will use that for our system.
Yeah, I think what you're saying is correct, but essentially by putting that ligand on the outside, you're haptenizing the protein, so you're making it appear non-natural to the immune system, so it might well, and probably will, raise an antibody response to it. So the question is, how many times can you image, and whether the antibody response takes out subsequent rounds?
Okay, I see. I will think about that thing. Thank you.
Thank you very much. The next speaker